Hello, my name is Hal Norris. I'm the president of ARC Medical, and I'd like to welcome you to this in-service on the use of the ThermoFlo system for providing optimal humidification for your intensive care unit patients. ARC Medical was formed in 1990 specifically to address the needs of providing an inline humidifier for ICU patients from intubation to extubation. In August of 1994, an abstract appeared in Chest Journal specifically talking about the ThermoFlo device and comparing it to a conventional heated water bath humidifier. There was no difference in sputum characteristics between the ThermoFlo system and a conventional heated water bath for as long as 25 days. What you're going to see in the next few minutes is how to use our device in several different systems. The information presented at the time of this taping was current. If you have any additional questions, please contact the company or contact your local ARC medical sales representative. Thank you for choosing the ThermoFlo system for humidifying your patients, and if we can be of any assistance, please contact us.
Hello, my name is Tim Nates. I'm Regional Manager for ARC Medical. The goal of ARC Medical and the ThermoFlo system is to replace the need for heated water bath humidifiers. Conventional passive humidifiers have been on the market for many years. They were originally intended for anesthesia and recovery. They were limited in their use, however. They provided anywhere from 25 to 29 milligrams of water per liter of air. The ANSI Z79 standard and the AARC clinical practice guidelines for humidity is 30 milligrams of water per liter of air. The ThermoFlo system will provide in excess of 33 milligrams of water per liter of air at the ISO standard of testing. Therefore, we're 25 to 35% more effective than current products on the market today. One of the advantages of using the ThermoFlo system versus a heated water bath humidifier is that we now have a cool, dry, water-free circuit. We do eliminate many things. First of all, we eliminate the need to purchase and use sterile water, having water traps in line, having to use water columns, and any PEEP spray associated with disconnecting the circuit. Now we'd like to demonstrate using the ThermoFlo system using 4 separate procedures. The first one we'd like to demonstrate is using the ThermoFlo with an MDI adapter and a closed suction system. Keep in mind it is important to lavage the patient, keeping the lavage solution away from the media. It is also important that you follow manufacturer's instructions on this procedure. Hold the unit at a 45-degree angle, advancing the catheter 4 to 6 inches into the endotracheal tube. This is a very nice guide for the lavage solution to go down the catheter into the ET tube. Then you will administer your lavage, you will hold your suction, and complete the procedure. It is perfectly acceptable to use the MDI adapter in front of the ThermoFlo. If you are to use the MDI in the circuit, you'll use the same procedure as a nebulizer. Next, we will show the use of the ThermoFlo system using an inline nebulizer combined with a closed suction system. It is very important that the ThermoFlo be removed from the circuit due to the fact that the medication will not traverse through the media into the patient. First, we'll disconnect our closed suction system from the ThermoFlo and then from the circuit, placing the patient side up. We will then reconnect our closed suction into the circuit, taking our nebulizer, inserting it into the circuit. This is now a very good environment for giving our medications because the circuit is cool and dry. After the treatment, we'll take our nebulizer out of line. We will disconnect at the closed suction system, reinserting the ThermoFlo back to the circuit, reattaching our closed suction system. Within 10 to 15 minutes, our circuit will be back to a cool, dry state. Let's move on to the demonstration using open suction combined with an MDI adapter. We strongly recommend that you use a flex tube between the endotracheal tube and the device. This helps keep secretions away from the media. It is perfectly acceptable to position an MDI adapter in front of the device. However, if using an MDI inline, you would use the same procedures as a nebulizer. While performing the open suctioning technique, we disconnect the ThermoFlo from the circuit, insert our breathing bag behind the device. Having the ThermoFlo in line helps keep the bag mucus and moisture free. After the suction technique is complete, we remove our bag and reinsert our circuit. Finally, we'll show the procedure of using open suction combined with an inline nebulizer. We still recommend that you use a flex tube adapter in front of the device, which helps control secretions that may get into the media. Keep in mind that any medication delivered in the circuit behind the device will not traverse through and get to the patient. At this point, we take the ThermoFlo out of line, keeping the patient side up. We reconnect our circuit back to our flex tube adapter. We position our nebulizer in line. The cool-dry circuit makes for better drug delivery. After treatment, we remove our nebulizer from the circuit. We reposition the ThermoFlo in line, and within 10 to 15 minutes, we have a cool, dry circuit.
Now that you've had an opportunity to see several ways that the ThermoFlo system will work in the circuits on your ventilator patients, I'd like to talk to you about a very important method of evaluating whether or not this device works. Your hospital will probably ask you to fill out a form such as this one, which is the ARC Medical ThermoFlo Filter Sputum Evaluation Form. This sputum evaluation form is, in essence, the protocol on how to use our device. At the top of the form are the contraindications for use with the ThermoFlo system. Number one is copious amounts of bloody secretions. Number two is an expiratory volume 10% less than inspiratory volume, in essence, a fistula. We also have some recommendations that we have at the top of this. We ask you to use the ThermoFlo system on newly intubated patients. Patients who are already on another heated humidifier can be switched to the ThermoFlo filter, but they do require some additional effort and possibly psychological preparation. The second thing is that, just a reminder, that when you use metered dose inhalers, it is perfectly acceptable to use them between the ThermoFlo system and the patient. If you're doing nebulization or metered dose inhalers back in the circuit, you must remove the ThermoFlo device before using an inline in-circuit MDI adapter or inline nebulization. Third, again, to remind you that you must follow manufacturer's recommendations on lavaging of patients. Please do not allow the lavaging solution to flow into the device. The goal is to lavage the patient, not the ThermoFlo device. We recommend that you replace the device every 24 hours or sooner, depending on secretions. The presence of secretions in the device by itself is not a reason to change the device. If you're having an increasing resistance that you deem to be clinically significant, replace the device with a new ThermoFlo. If you have just secretions in the device, it is not necessary to change the device. In order to determine whether or not the ThermoFlo device is doing what we say it does and what you would like for it to do for your patients, we have come up with 3 definitions of watery, moderate, and tenacious secretions. You will place the ThermoFlo sputum evaluation form with your patient's chart. At report, the therapist in charge of that patient will circle whether or not that patient has watery, moderate, or tenacious secretions. As long as the secretions are remaining in the watery to moderate area, you leave them on the ThermoFlo device, changing it every 24 hours. If the secretions become copious, we give you 4 things to do. If you're using a closed suction device, you should increase the frequency of suctioning so that you just clean out the T-piece and clean out the endotracheal tube more frequently. Secondly, is to position the device above the patient so that the secretions do not foul the ThermoFlo. Third is to replace the device on a per shift basis every 8 hours. This does not give time for mucus and moisture and secretions to build up in the ThermoFlo, causing an increasing resistance. Fourth is to switch to a heated water bath humidifier. It's important to note that if you're using an open suctioning technique, you should reverse steps 1 and 2. If you have tenacious secretions, we recommend 4 things. The first thing to do is to check for air leaking around the endotracheal tube cuff and correct. Secondly is to check for proper hydration of the patient and correct. The third thing to do is to manage the secretions with extra lavaging, remembering that even on heated water bath systems, tenacious secretions occur occasionally, and that it may be something that's happening beyond our control for a few hours that will cause this tenacious secretion. Fourth, if it doesn't change, you can always switch to a heated water bath humidifier. The information contained in this video is correct as of the date of taping. If you have additional questions or would like additional information, please contact ARC Medical directly at 1-800-950-ARC1. Thank you very much for your time, and thank you very much for your use of the ThermoFlo system.